Welcome to The Explainer. Today, we're tackling a really critical issue in the mental health landscape, and that is major depressive disorder. But more specifically, the frustrating roadblocks to actually accessing life-changing treatments. For millions of people, depression is way more than just a passing feeling of sadness. It's this exhausting, daily battle that can make even the simplest tasks feel utterly impossible. And while traditional paths like psychotherapy and daily antidepressants are definitely the standard first lines of defense, they just don't work for everyone. So we're going to explore a highly effective alternative today, and honestly, more importantly, how to actually navigate the complex web of getting insurance to pay for it. So what happens when traditional antidepressants just aren't enough? This is a vital question because statistically speaking, about 1/3 of patients never achieve full remission of their symptoms, even after trying multiple different medications. They endure the side effects, they wait out those long weeks or months, and still, that heavy fog of depression just remains. This is what's known as treatment-resistant depression, and if you or your patients fall into this group, it can feel incredibly hopeless. But when those traditional pills aren't cutting it, you have to look to modern neuroscience. Okay, let's dive right into Section 1, A New Hope, transcranial magnetic stimulation. For folks who feel like they've totally reached the end of the line with pills and talk therapy, transcranial magnetic stimulation, or TMS for short, represents a powerful, evidence-based new hope. It's actually widely recognized as one of the most important psychiatric innovations of the last 20 years. TMS is completely non-invasive. It uses highly targeted magnetic pulses to stimulate very specific underactive areas of the brain. Think of it like a highly localized magnetic jumpstart. When someone is suffering from major depression, specific brain regions, like the dorsolateral prefrontal cortex, become really sluggish and underactive. The magnetic pulses generated during TMS essentially wake up those sluggish areas, enhancing serotonin, dopamine, and glutamate signaling, and promoting long-term, healthier brain activity. And the difference between this and traditional medications is absolutely stark. On one hand, you've got systemic treatments. When you swallow an antidepressant, that medication travels through your whole digestive tract and affects your entire body. That's exactly why patients get systemic side effects: weight gain, insomnia, stomach issues, you name it. But on the other hand, we have the targeted approach of TMS. Because it uses a localized magnetic field, it literally only stimulates the specific brain region responsible for mood regulation. No surgery, zero anesthesia, and absolutely no full-body side effects. It's a precision tool rather than a blunt instrument.
Moving right along to Section 2, how TMS actually works.
So we know the science behind why it works, but what does the actual patient experience look like if they walk into a clinic tomorrow? Well, while the idea of using magnetic pulses to alter brain chemistry sounds like pure sci-fi, believe it or not, this technology was first developed by researchers in England way back in 1985. Fast forward a bit, and it received its first official FDA clearance for treating major depression in 2008. So we're talking about a treatment backed by decades of solid research, refinement, and real-world clinical application. And the timeline for this outpatient procedure is surprisingly straightforward. It starts on day 1 with something called motor threshold mapping. A psychiatrist places an electromagnetic coil on the patient's scalp to find their motor hotspot. They literally send a gentle magnetic pulse until, pop, they see the patient's thumb twitch. This lets them perfectly calibrate the minimum dose needed for that specific individual. After that mapping, the patient comes in for daily sessions, usually 5 days a week. They just sit in a comfortable, reclining chair, totally awake and alert. Most people say it just feels like a mild tapping on the scalp. And because there's no sedation involved whatsoever, you can drive yourself to the clinic, get your 20-minute treatment, and drive right back to work or home. The whole course typically takes about 6 to 8 weeks. And this brilliantly illustrates exactly why patients commit to these daily sessions. The success rates are just remarkable. For treatment-resistant patients, we're seeing a 50 to 60% rate of significant improvement in their depressive symptoms. But even crazier, 30 to 40% of patients achieve complete remission. That means their depression symptoms effectively vanish. For a group of people who had already failed multiple medications and pretty much lost hope, those numbers aren't just dry statistics. They are entirely life-altering. Which brings us to Section 3, the absolute dragon of our story, the prior authorization maze. You might be wondering, okay, if TMS is so effective, why isn't everyone getting it immediately? Well, unfortunately, a doctor's recommendation is rarely the final word when it comes to covering the costs of advanced treatments. Before an insurance company pays a single dime, patients and providers have to clear this daunting list of hurdles. You have to prove a confirmed major depressive disorder diagnosis. You have to prove, with medical records, that you've tried and failed at least 2 to 4 different antidepressants. You need a documented attempt at talk therapy. You need recent high PHQ-9 severity scores. And to top it all off, a comprehensive letter of medical necessity from a doctor. Gathering that mountain of evidence is exhausting for the patient, and it is a massive administrative headache for the clinic. To put this into perspective, let's look at Hawaii's insurance landscape. The good news here is that major Hawaii insurers actually do recognize TMS as medically necessary. HMSA, Kaiser Hawaii, UHA, and even MedQuest through participating managed care orgs, they all offer coverage for TMS. The bottleneck isn't whether it's covered in theory. The bottleneck is the agonizing red tape and the incredibly complex prior authorization process required by each specific plan to get it approved in reality. Just consider this painful reality for a second. Even a single missing document can delay approval by weeks. Literally weeks. Medical practices end up spending hours upon hours just reviewing records, chasing down outside documentation from old doctors, filling out highly specific forms, tracking authorizations, and fighting endless denials. That is valuable time providers should be spending treating their patients, not battling insurance companies over paperwork. So, the crucial point is, who actually fights this battle? Let's get into Section 4, Access Revenue Hawaii Advocates. How do clinics offer this life-saving treatment efficiently without totally drowning in administrative burden? Well, Access Revenue Hawaii provides utilization review specialists. These are dedicated professionals who step right in to prepare these incredibly thorough, evidence-based authorization requests. But let me be super clear here. They aren't just pushing paper around a desk. They coordinate directly with the insurance companies to aggressively advocate for patient access to care. Every single prior authorization request represents a real, exhausted patient searching for relief. The Access Revenue Hawaii team acts as a passionate advocate fighting tooth and nail on behalf of both the patient and the burdened provider. They essentially take the entire burden off the clinic's shoulders in 3 simple steps. Step 1, they expertly gather all that comprehensive documentation we talked about earlier. The medication histories, therapy records, severity scores, the whole shebang. Step 2, they submit the prior authorization exactly to the payer's standards and they relentlessly track it. And step 3, if an insurance company tries to push back, these utilization review specialists handle the coordination of peer-to-peer reviews between doctors and they aggressively pursue appeals when it's medically appropriate. They literally navigate the maze so the clinic doesn't have to. Their entire mission boils down to this perfectly: remove administrative barriers so providers can focus on treating patients, while we focus on advocating for access to medically necessary care. This is exactly why this matters to you. Whether you're a mental health professional launching a brand new TMS program or a patient desperately trying to get your treatment covered, having experienced advocates in your corner drastically reduces those authorization delays and seriously improves approval rates. It gives providers their time back, and it gets patients into that treatment chair so much faster. So I'll leave you with this final, provocative question. Are you ready to break down the barriers to care and focus on what truly matters: patient recovery? TMS is a medical marvel, and it's changing lives every single day. The science is absolutely there, the success rates are there, and the insurance coverage is there. You just have to know how to unlock it. By partnering with dedicated advocates like Access Revenue Hawaii, mental health providers can finally conquer that prior authorization maze and help their patients step out of the fog of depression. Thank you so much for joining me on this explainer. Keep asking the right questions and never stop advocating for better care.